Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical health care. I would like to welcome naturopathic physician Dr. Paul Anderson. Dr. Anderson is a recognized authority in the field of integrative cancer research, coupled with the treatment of chronic diseases, genomic conditions, autoimmune, and infectious disorders. Thank you so much, Dr. Anderson, for spending some time with us today. I know you've had quite a busy schedule and are giving a very impactful talk tomorrow, I'm sure. So let's talk about when you were younger and what initially sparked your interest in going into medicine.
Well, that goes back a long way. So my father is a physician and my mother's a nurse, so I grew up with it. And I always thought about doing it, but I thought as I was kind of growing up and watching the way medicine was going, and this is going back to the 60s and 70s, I started to see that it was moving a bit away from personalization and all of that, and becoming a lot more mechanistic, which is how things go when you technologize something. And so I worked in and around medicine in laboratories and things for a number of years, but kind of avoided going to medical school and all of that. So that was sort of that immersion in medicine was really how I got interested. But I always knew I wanted to do something that had more, as much personal contact and personalization as I could get. And that's really what I was looking for a number of years.
So that's when you decided to go into naturopathic medicine?
Mm-hmm.
Okay.
Yes.
Now your father was traditionally trained?
Mm-hmm. Yes.
Okay. So what did your dad say when you told him that you wanted to go to naturopathic medical school?
It was, well, it was a little interesting because I wasn't sure how it was going to go over. But he's always been he and my mother both very open-minded people, and my mother, especially as a nurse, was always into a lot of integrative and natural remedies and things like that. So I also grew up around that a little bit. But I talked to him one night, and he thought a little while, and he said, it's probably not a bad way to go nowadays. He says, the way things are going in the other world of medicine, you'd probably get bored and not like it. And I said, that's what I thought too. So
was he a general practitioner? What did he practice?
No, he's actually an eye doctor.
Okay.
Yeah. So he's a specialist. Yeah.
Okay, so fast forward a bit, and you founded the Advanced Medical Therapies out in Washington.
Mm-hmm.
So you specifically focus on IV therapies and hyperbaric, oxygen therapy and infrared medical therapies. How did that all come about? When did you, what was the catalyst?
So Advanced Medical Therapies in Seattle is the next evolution of the previous 20 years of practice, or more than that actually. What came about, really, to shorten the story as much as possible, is about the first 5 years of practice I did very general practice. What I found was that while I was doing general practice, more people with tougher problems were coming in, and people with chronic infections and cancer and all sorts of other difficult things. So I started to do extra training and study to try and help those people. And if you think back to, say, 20 or more years ago, there just wasn't a lot of integrative medicine training for those things. You learned a little bit here and there. So that's kind of where the idea for what we do now started. But in the intervening 15 years, my practice really evolved to about half cancer and half very advanced chronic illness like autoimmunity and brain trauma and all sorts of other things like that. About 10 years ago now, I had the opportunity to, in addition to my practice, to be involved in some NIH-funded cancer research. And specifically what they were funding was to see if integrative oncology could either improve quality of life or extend life in people with advanced cancers. So it was a really unique time. And although I was already very fully employed and working a lot, I couldn't turn it down. So we did a 5-year trial with humans looking at integrative cancer therapies. And we learned a great deal, as you would. And because it was federally funded research, We were collaborating with the University of Washington and the Seattle Cancer Care Alliance. It was a pretty big deal for integrative oncology. And what happened because of the nature of research, where you have a little more latitude to do things that you may not if you weren't doing research, we were actually able to innovate a number of integrative therapies that when we started, we didn't even know we were going to be able to do. So that time, those 5 years, moved not just my practice, but also writing and teaching of integrative oncology, et cetera, forward quite a bit. So a few years back, we sat down, our clinic group, and decided that we were going to just focus on the things that were truly advanced therapies that we had really developed through those years of research and other experience, and have a place where other practices could refer patients for these very specific therapies. And you mentioned advanced IV therapies, hyperbaric oxygen therapy, and low-level hyperthermia therapies, and things of that nature.
So is being utilized to complement the traditional modalities, or is this on its own?
It's all of the above. Yeah, it's
okay.
It truly is an integrative clinic in that. For example, I'll give kind of the two ends of the spectrum. There are sometimes, say in oncology, or maybe say some other disease that we're treating, where there's a standard treatment that's actually quite successful, statistically. And if someone comes in and says, well, I have this type of cancer and it's at this stage, and we look and we talk about it, and really the standard therapy is 80-90% successful, what we counsel them to do is to do the standard therapy and then let us augment it and let us keep you healthy during it and afterwards, right? There's another group that's similar to that, where they're done with standard therapy, and the standard oncology world is great at getting to that point, but then on the preventive side, it gets a little fuzzy afterwards. So they say, well, you have no evidence of disease. Go live your life and come back if you get more cancer. Well, a lot of people don't like that news, so they'll come in and they'll say, can you help us with prevention? And it's called secondary prevention. We have a lot of things we do in that. That's another big area. And then the final is a little more what we were doing in the research, which we got very good at, and sadly there's a lot of people in this group. There's a lot of people where the standard therapies, they have their disease is too advanced for them. And the standard therapies might do a little bit, but they may be as toxic as they are helpful. And a lot of oncologists now will tell people, at your stage, it's probably not going to help you to do what we have. Can you find something that's alternative or integrative? So we do a lot of that too.
Do you have success?
Yes, we do, actually.
At prolonging life and giving them quality of life?
Mm-hmm. Yeah.
Wow, fascinating. Yeah. Any particular cancer that's more effective?
Of course, just statistically, the cancers that more people have, we see more of. So things like breast cancer, prostate cancer, colon cancer, lung cancer, those ones that are much more common. We also have a lot of patients who have different types of brain tumors, blood cancers like leukemias or lymphomas, hematologic cancers. We work even with some pediatric cancers. So it just really, what we always tell people is you can have 3 people with the exact same stage of the same cancer, roughly the same age, same gender, and they'll have 3 totally different outcomes, because what goes on is what their body has left to fight with is what we can work with usually. So if they still have a good vitality and we can access that, we've had people, we have one, she started way back in the research days. She was 85 and she was told she'd live 6 months or less with very bad cancer spread through her abdomen. And she just turned 93.
God bless.
Yeah, she's still alive, totally healthy. Her cancer is there, but it's basically asleep. And she's 93. She at 85 she thought, well, I want to live a few more years. And
did she go through conventional protocol too?
No. Well, she went for surgery thinking she had another problem, and the surgeon looked and said, oh no, it's cancer. It's not whatever the other problem was. And the oncologist said, you're 85. I will probably kill you if I treat you. So go and get your affairs in order. So she did completely integrative therapies. And it was amazing, and she's very pleased with the outcome. So yeah.
That's incredible. May she have 20 more years.
Yeah, she's a spunky lady too, though. So,
So how did you come to learn initially about these other integrative therapies that you've included into your practice?
you know, one of the reasons that I was invited to join the research group was that's what I'd been doing the 10 years prior, is going everywhere trying to find what worked, what might work, what was out there, because there wasn't really a lot of information that had it all under one roof as far as these are the things you could do. It was also a little politically, not friendly to do integrative oncology care back in those days too, so you had to be a little careful. So the two steps were the 5 to 10 years prior to the research. I was spurred on by my patients to find anything new I could. So I just went everywhere to any conference that had any information, talked to friends. And back in those days, there was a small group of us that were doing a lot of integrative oncology, and we'd talk and share notes. And then, through the research, as I said, because we had a little bit of protection in the research to try new things, that really kind of took it to the next level, because we could go to our patients and say, these other things aren't working that we've tried, but we have these new things that, make sense biologically. Would you want to try this? And they usually would, and then we could kind of see how it did. So a lot of the initial things were just very one piece at a time, learning and then working with patients, and then it kind of snowballs over time, and that's why now I do a lot of teaching about those things.
And how do you choose which modality works for your patients, whether they have cancer or other chronic illnesses?
It's to a degree. It's now become a little bit more systematized, although it's still very individualized. The first thing that we do is that whole screening of how, are you at a small, medium, or large level of disease, whether it's cancer or not. Have you had the problem short or long amount of time? And then the other thing really is the patient's vitality, because with a lot of integrative treatments, if they have good vitality, the treatment works better because it's got something to work with. So we kind of put all that together in a decision rubric or decision tree. And if you get somebody then that is at a particular place, we'll say, well, based on what I've seen and what my colleagues have seen over these decades, we usually have good success with this particular track of treatment, and we start there. But we always say, you may be the different one. So we check in at a certain amount of time, and if it's going well, we keep doing it. If it doesn't seem to be working, now we have a lot of other options. So a lot of it is that sort of calculus of how long have they been ill, what kind of illness and depth of illness, how much do they have left inside for fighting, and then what have we seen work in the past. So what I would say is, as opposed to say 20 years ago, in my mind, looking at it now, we have a lot more sophisticated way of making decisions, and we also have just more options of what to do.
So when you first started this, especially the cancer treatments, what kind of pushback did you get from the medical community within your
essentially, in the early days, 100% of oncologists would tell their patients one of two things. Either, if you see Dr. Anderson, we will not see you as a patient. You cannot get treatment from us, that's an uncomfortable place to be. Or the other was, I don't care if you see him or not, but he'll probably kill you. Those are the two things they were told. All right. Just to be fair, there was one doctor who was about to retire. This is about 20 years ago, and he would actually refer elderly patients to me because he didn't care anymore, and he would say, look, you're 80 years old, I'll kill you if I treat you with chemotherapy, why don't you go see Anderson? But he was the only one back in those days. So in those days, it was very, very, very contentious. And I'm not saying that's not around anymore, but even when we had the research and we were financially and patient-wise connected with the big university and everything, it was a cold warm-up there. And really what's been my experience with all collaborative things is the doctors at the university and the SCCA, et cetera, slowly, the ones that you build rapport with, they would open up and we would be able to share other research, and then they would open up a little more. And pretty soon, we had actually very good referral relationships with a number. So it's a different world now. It's not that you're greeted with open arms by oncologists, but there are many oncologists who know that, what they do fits in this place, and there's this other world that, can be done very safely. So it's better.
From my understanding, the Seattle, Washington area, Oregon area, et cetera, they have a very strong naturopathic community. So I can imagine that the majority of your patients are coming in from that area, or do you have people that come in from outside?
I would say probably statistically, most of the patients we see directly are from the Northwest, yeah. And we have some people who actually come in for a week at a time and get treatment set up, and then they go home and they'll come back and do follow-up, and we'll find doctors back home that they work with. But probably 95% are from the Northwest.
So you started a podcast, and that is geared towards the patient community,
yes.
Correct? Okay, so what was the impetus for that?
I had really never thought of it before, and a friend of mine this was before everyone had a podcast, I guess, or whatever. A friend of mine said, you should really, you love talking, you love teaching, you should really have a podcast. It'd be good to educate patients. And I thought, I thought about it for a while. And then I worked with because I had no idea how you do a podcast, so I worked with some people to help get it going and produce it. And it's called Medicine and Health with Dr. Paul Anderson. It's on all the podcast feeds. But it's aimed at, our tagline is helping you with the mysterious world of how doctors think. And so I have topics, usually I do a month of topics and talk about mostly integrative medicine areas. Sometimes I'll do kind of standard medicine things of why would your doctor send you for these tests, but most of it's about integrative medicine. And so we've done whole months on how to safely integrate things like nutritional therapies with standard therapies, and where to be careful and things like that. We did recently, which was kind of a lot of fun, and a departure, was a whole month on mind-body medicine. We've done a lot of resources on, say, chronic infectious disease like Lyme disease and things. Cancer obviously has been a big, and we just break it down to a little bite-sized piece. Usually it's about a 50-minute podcast, and now there's quite a few of them in the memory bank, so people can kind of look for topics they like and get it.
So you're known for your outside-the-box cancer therapies and alternative therapies, but who is your typical patient today that doesn't have cancer?
So the patients who don't have cancer in our clinic now at Advanced Medical Therapies it's a lot like the cancer patients that we see. They're usually referrals, a lot of times from other clinics, and it's either to avail themselves of these therapies that we're talking about, or it's because they've had something like a chronic infectious disease for 20 years and they just haven't gotten anywhere with it, or they have a undiagnosable but very impactful neurological problem, or those sorts of high-level chronic illnesses that we don't do any acute care medicine. It's all chronic things. Autoimmunity and infectious disease are the big ones outside of cancer.
So what kind of patient can benefit from utilizing the hyperbaric oxygen therapy?
Yeah, hyperbaric is really it's something I've been involved with for a long time, and it's probably the one area in integrative medicine where the research was really slow and kind of all geared at, say, dive injuries and a few other things until recently. In the last 5 years, the research around using it with things like mild traumatic brain injuries, people that get a concussion in a car accident, or athletes, or research around even use in infectious disease or neuropathies, nerve problems, but also research around its use in cancer, which used to be really controversial. All of that in the last 5 years has just mushroomed. And so I speak at hyperbaric medical meetings a lot, and the two things that I'm normally asked to do are, one is about cancer and hyperbaric medicine, because it's been so confusing and controversial, and update people there. And then the other is synergistic use of hyperbaric medicine in neurological and other injuries. And what we mean by that is, so we do other things at the clinic, what we have found over time is if you have nerve injury and we give you an IV therapy that helps with the nutrients that repair nerves, and then we do hyperbaric with it, you get not just a doubling effect, but a synergistic effect, for example. We also, with certain cancer therapies, we can get a synergistic effect by doing hyperbaric and that. Because basically what hyperbaric does is it increases the amount of oxygen that's in your plasma, and it makes there's a movement of oxygen into cells. And the importance of that is when you get real sick, the oxygen flow slows down, the cell builds up carbon dioxide, gets acidic, and it slows down nutrient transport in. So what we find is if we clean the oxygen part up, the nutrients go in easier, they heal better. So that's our big uses of hyperbaric. A lot of neurological things, a lot of cancer things, and then now more things in the chronic infectious disease.
So you're speaking tomorrow about?
Tomorrow is specifically in the general session about hyperbaric and neurological injury. And because the time is limited, as it always is, of course, what I'm really focusing on is updating the physicians on the last 3 years of science that shows that hyperbaric is a lot more versatile than we used to think it was. And because, just to really shorten this up, because hyperbaric largely grew out of the dive industry, most of the original treatment ideas came from dive accidents, which are very different than your average patient walking in, So yeah, if you have a dive accident, you use the Navy dive tables and all that. And if you don't have a dive accident, what the science is showing is you can be much more specific with different levels of pressure and oxygen, and you can trigger healing for neurological injuries and brain injuries and other things with much less effort than we used to think was necessary. So my goal tomorrow is to update that science, but also show how we do it, where we use other integrative therapies to make it work better.
Can you speak about infrared medical therapies and what that is?
Yeah, so in the U.S., there's, in reality and in the whole world, there's different levels of heating the body up. They call it hyperthermia. And if you look at the Germans are some of the most far advanced on this level as far as hyperthermia, especially with respect to bad infections and cancer. So they have the most delineated research about that. Most of the machines that warm people's bodies up use some kind of infrared system to do that. There's many different ways to do it. So, for example, I collaborate with a hospital that's not in this country, and I set up cancer protocols for them. And they have, it's a hospital, so they have all these different types of hyperthermia devices that get people to very, very hot levels. And it's either heating one organ up, if that has cancer, or your whole body. And they're highly monitored, and we give them special IVs and all this through it. In America right now, there's those levels of machines and abilities to do hyperthermia are under investigation to be approved. So what we have done is, of the 4 levels, we can go through the first 2, maybe 2.5 levels legally with the approved equipment that's here. And so in reality, it's the same generation of heat. It's the same mechanics. It's just we can't, with FDA approval, go higher than a certain level. So Canada and Mexico both can, and I collaborate with places in both of those places. Here it's investigational, and we're hoping they're doing a very big trial at a major university, and we're hoping once that goes, we can move that forward here.
So, by your knowledge, what are the new technologies that are coming down the pike in the next couple of years?
You know, there's a lot, and I think a recurring theme that I see now, which I think is wonderful, and it's partly technology has advanced, but also our understanding of things has advanced. Newer and better ways of hyperthermia that we were just talking about, more specific or more intensity of the graduation of heat, et cetera. The other thing which we're doing, and is really, the Europeans are ahead of us on this, but we have FDA clearance now to do certain things with, is laser light therapy. And again, different bands of light do different things to different cells. So we'll use laser therapy either topically, you can also use it as inside of a joint in an injection. You can actually put it into the bloodstream and run the blood by lasers. There's a lot of things there that are going on, and there's different effects on your cells and your tissues by different light levels. So really, there's
what is it being tested on? What kind? Is it for cancer? Is it for illness?
So
or?
it's what's interesting with laser is it's a little bit like heat in that it's a secondary effect because it's causing your cells to do something because they're being excited by either heat or light wave. So what we're using it for right now is augmenting certain cancer treatments, but also nerve injuries, certain types of healing that are very slow. Sometimes people get nerve damage that won't want to heal. It appears to be good at that. The other is people with fatiguing injuries because the energy parts of the cell mitochondria are very sensitive, it turns out, to certain light bands. So we're experimenting with that now and different photosensitizing things for that.
So you have a book coming out.
I do.
So can you, you
it's
partnered
right here.
with Dr. Mark Stengler.
Dr. Mark Stengler and I were both in medical school around the same time, and we hadn't seen each other in literally 20 years. And he came to some conference I was speaking at and said, you know, we both went through that same thing I said with cancer. We started not knowing we were going to do it, and then we had to learn as we went. And he says, you know, your story is very different from mine, but he says, I think together we'd have a really great story. And would you want to do a book? And I said, sure. You know, so what the book is, there's 10 chapters and then a little bit extra material. We specifically wrote it to patients and families because that's the area where we felt like we'd have the most impact. But what we did that was the hybrid part is every chapter is referenced as if it was a medical textbook. So there's around 1,100 references just for this book. So the patients don't necessarily have to read all those. But if they go to their doctor and say, well, I've been reading about these mushrooms, or I've been reading about, you know, hyperthermia or whatever, and the doctor says, well, I've not heard of that. Is there any research? They can just look right in the back, and there's probably a lot of research. And a lot of that came from both Mark's work with certain things he was doing, and then my work with my research and collecting these over the decades. So the point of it is to go through and partly to demystify the cancer experience for patients and give them a little bit of behind the scenes and how decisions are made and all that. Part of it is to honor the idea that we truly are integrative oncology practitioners. We're not saying this is good and this is bad. What we always feel is there's just a good time for different things. And so we very much do what I said at the beginning, which is if you have a very treatable type of cancer from the standard perspective, please get it treated from the standard perspective and let us keep you healthy and help you stay healthy after. If you kind of have one of those at the other end of the spectrum where they say it's probably too toxic to do this treatment with you, we have things we can do for that. So we really believe in fitting things in, and we talk a lot about that in the book. The other thing that we talk about in more of a public-oriented way is why are there all these different theories of why cancer grows and starts and all this, and how is it that they really are not different, and where's the overlap there? It's a short chapter that I got to write, which was a real honor, but the reason we put it in, even though this is for patients and family, we know doctors are going to read it too, but is the reasons we believe cancer starts or grows or gets promoted are what give us the therapies that might work the best for it. So if we're confused about why cancer is there, we might not make good decisions about what to do about it. So we have information like that. We have a lot of information about, you know, because as you know, if you get diagnosed with anything, but especially cancer, you'll get 100 people telling you 100 different supplements you should take or 100 different whatevers, right? So we go through pretty much all of those and say, these are the ones we would use. Here's the ones with the best research. If you're going to spend your money on something, prioritize here. If you're going to go to a doctor who does IV therapy, here's information about the different IV therapies. You're going to get hyperthermia, whatever. All of that's in there. And then we have a section on the more common cancers and what we find works the best in each of those too. So a patient can have a place to start.
So let me ask you, for a patient that might have breast cancer,
Mm-hmm.
is there a different protocol for a patient who tested positive for BRCA than one that doesn't?
There's sort of a augmentation of the protocol, I would say. So if you have BRCA, and some of the recent research kind of matched what we've seen, is that may or may not be as impactful as some of the other things we may not know about that go along with breast cancer. It was the first thing we found. But BRCA is really a genetic issue that you inherit that decreases some of your protective mechanisms. So one of the things with that is if you have a particular level of breast cancer, the recommendations are probably similar, but we're going to be more intense about that protective end that's missing because of the genetic stuff. So it's more, that gene doesn't necessarily make you, destined to have something bad happen, but it means you have to be much more careful because there's like a hole in the bucket and you have to fill the hole.
Right. Now, if somebody tested positive but did not have breast cancer, would they come to you prophylactically?
Yeah, we now, and this has been a big change from 20 years ago too, is we now have people who come in, or they'll say, my mother was just diagnosed, or my mom, my sister. I'm fine so far, they tell me, but I don't want to get breast cancer. So we work with people like that a lot too in just primary prevention. And it is, and sometimes things happen, but it's way easier to prevent anything, but especially cancer, than it is to treat it once it's there. So we do have that.
So you personally, what do you do for yourself? What supplements do you take, and what protocols do you do to keep yourself healthy?
And that's been an evolution as well, because I've tried, you usually try everything on yourself anyway and see what works. What we really promote with our patients, and it's in the book a lot too, is you want to start anything about your health, you want to start with the things that you're going to have to do anyway. So that would be how much you sleep, how you deal with stress, how and what you eat, how and what you drink, exercise, all those things. And so I will tell you, working around people who have terminal illness it does make you think every day about, what am I doing to not head down this pathway? So what I do on that level is, even though I travel a lot and speak a lot, I do try and tend to my sleep, which is really important.
How many hours do you try to get?
7 to 8, depending on the schedule. Sometimes maybe a little more, but that's way more than I used to do. I used to be very bad with the sleep thing. I'd stay up and work and all of that. I don't do that anymore. I try and have a mindfulness meditation practice, which has actually helped quite a bit too. I do particular type of eating that we've experimented with a lot of things, but the science is very good around what they call intermittent fasting. We talk about in the book, and because I know I don't have a lot of known genetics for cancer, I have a lot for diabetes and some other diseases. Over the course of about a year, I was actually able to reverse a lot of the blood markers for certain diabetic markers and things. So I continue to follow intermittent fasting. I do as clean a diet as I can, a lot of good vegetables and clean protein, clean fats. I exercise, all of that. And then the next layer, what I always tell people is, if you're just going to take pills or do other stuff, that's okay. But if you're not sleeping and dealing with your stress and eating decently, the pills are just going to kind of fall into a trap. They'll help a little bit, but they won't help very long. So then I'm attentive to the core things like antioxidants and B vitamins and minerals, all the basic cofactor things the body needs. And then throughout the year, I rotate other things that are fat soluble. So I might do some phospholipids, which are very good for your brain. I will rotate some good fats like fish oils and things, and other things of that nature.
Can you share one last pearl of wisdom to the physician community that might be watching?
One last pearl. Well, I think wherever you're coming into this and you're watching, because I speak a lot, I speak to a lot of physicians who first or second exposure they have to integrative medicine, and it sounds great, but it's very overwhelming, because you're trained in the standard system and you're good at whatever you do, but you know that there's this next thing you want to add. If you're at that step, just get the best information you can. A4M's great for that. And just add one thing at a time. Don't try and take it all in at once. If you're on the other end of the spectrum and you've been doing it for a while, you may find, like I did, that there's a lot of things, because we're all creatures of habit and we get good at certain things, whether it's cancer or neurological problems or whatever. And we just do those. And sometimes it's good the longer we practice, like myself, you step back and say, has anyone discovered anything in the last 5 years that maybe I missed, or, or because there's a lot of things, quite honestly, as a practitioner who's done it for a long time, I heard about 10 or 15 years ago and I thought it's too good to be true, or it wasn't legal then, or it wasn't available, but it sounded cool. And now maybe it is available, or now maybe there's more research on it or something. So I think if you're on the other end of the practice spectrum, again, adding one thing at a time, but there's some really great things that I think have changed in the last 4 or 5 years that a lot of us more seasoned doctors, you could say, we didn't know about. So I think whatever you're doing, just add one at a time and move forward, and know that there's a lot of really new, exciting things that can help your patients.
Well, thank you so much. Best of luck with the book.
Thank you.
And best of luck tomorrow with your presentation.
Thank you.
I look forward to
All right.
hearing all about it.
Thank you for having me.
Thank you so much.